So in the first section, we talked about what is acute suppurative otitis media, what are the different routes of infection, what are the predisposing factor, and how we can treat acute suppurative otitis media. And now in the second section, we will continue about some other topics that are related with acute suppurative otitis media. And in this section, we will talk about the stage of tubal occlusion and pre-suppuration, and also we will talk about the resolution when the recovery is occurring from the suppurative otitis media. What are the different stages of resolution? And also we will talk about the complications of suppurative otitis media. So stage of tubal occlusion, this tube we are talking about is the eustachian tube. Here when there is blockage of the eustachian tube. Eustachian tube connects the pharynx or the throat with the middle ear, and it mainly responsible for maintaining the balance and pressure in the middle ear. So edema and hyperemia blocks the tube, leading to absorption of air and negative intratympanic pressure. So this tube, if it's blocked as a result of maybe edema is the swelling due to fluid retention, or hyperemia if there is excessive blood flow, that can lead to the occlusion of the tympanic membrane. And when that is blocked, the air pressure present in the tympanic cavity or middle ear gets absorbed. And once the air is absorbed, this can cause negative pressure in the tympanic cavity. So you can see this tympanic eustachian tube is blocked. This is the eardrum, and this is the presence of fluid in the middle ear. Symptoms of this is tubal occlusion is deafness and earache. And then signs are tympanic membrane is retracted. It is pulled back, retracted because of that negative pressure in the tympanic cavity, retracted back. The symptoms, tube is blocked, there is very bad earache, and patient has fullness and they cannot hear anything. Deafness is there also. So this is tubal occlusion, eustachian tube occlusion or blockage, maybe due to edema, swelling, hyperemia, and it can cause absorption of the air and negative intratympanic pressure. Now, stage of pre-suppuration. Pre-suppuration means before the suppuration or before the fluid or before the pus or suppuration develop in the middle ear. What are the stages of pre or before that happens? Pyogenic organism, we already mentioned acute suppurative otitis media is caused by the pyogenic microorganisms. So pyogenic organisms like Streptococcus pneumoniae invade the tympanic cavity, causing hyperemia of its lining. So there is increased vascularity, increased blood flow, increased secretions, all that can happen before the actual suppurative phase. Symptoms are earache with disturbed sleep. If there is earaches are very bad, and when there is earache, usually patients have problem with the sleep. They cannot sleep restfully. So, and then after that there is deafness and tinnitus. Tinnitus is ringing in the ear. Child runs high degree of fever and is restless. So pain, there is fever, there is deafness, there is tinnitus. And in children, usually they cry a lot because they are very restless and they cannot describe their discomfort very well also. Some signs are congestion because of hyperemia. You can see congestion in the pars tensa of the tympanic membrane. So there is hyperemia, increased vascularity. You can see this is the cartwheel appearance presence. Cartwheel appearance. Blood vessels handle of malleus and periphery. So there are a hyperemia and there is, you can see visible blood vessels in the handle of the malleus and the periphery. So all these changes can occur in the stage before the suppuration, which is known as the pre-suppurative phase. With the invasion of pyogenic microorganisms, there is hyperemia and there is increased secretions and there is reddening and there is pain, fever, tinnitus, deafness, and all these changes can occur in the pre-suppurative phase. Then next is the after the changes in the that can lead to hyperemia and tinnitus and deafness and pain. Finally, there is formation of pus in the middle ear and in mastoid ear cells. So there is now formation of the pus. And you can see this is the pussy through the tympanic membrane. You can see the pus and that pus can put pressure on the tympanic membrane, leading to very bad earache, excruciating earache accompanied by vomiting and convulsions. Signs are tympanic membrane, you can see it's red and bulging, and then once it's ruptured, you can see the yellowish pus coming out. So yellowish spot before the rupture can be seen in the tympanic membrane where rupture can occur. So all these changes which you can notice, like symptoms like pain, earache, and then tinnitus, fever, all these are as a result of formation of pus in the middle ear, and earache because the pus is exerting pressure on the tympanic membrane and tympanic membrane is bulging out unless it gets ruptured or perforated and that pus is drained out. It cannot a patient won't get better and won't feel relieved. So this is the tympanic membrane with the pus in the middle ear. Next stage of resolution, how it resolved. We went over the pre-suppurative stages and now the stage of resolution. In this, the resolution, as I mentioned in the previous slide, will occur with the rupture of the or perforation of the tympanic membrane and discharge of the pus from the middle ear. So tympanic membrane ruptures with release of pus and subsidence of symptoms. Symptoms now, earache is relieved, fever comes down. Signs are external auditory canal may contain blood-tinged discharge which later become mucopurulent. So first there is bloody stained discharge because of all that hyperemia, pressure, and pus. The first discharge is discharge with blood things, and then later on slowly it becomes mucopurulent, and it takes a while to recover, and it's not very, it takes about a month or 3 to 4 weeks. This is the pussy discharge. You can see yellowish discharge coming from the perforated tympanic membrane. Hyperemia of the tympanic membrane, you can see it's all the redness is due to hyperemia. Now some complications occur as a result of suppuration, as a result of perforation of the tympanic membrane. There are some complications that can occur, and those are the complications basically depend on how virulent was the causative organ and how poor was the resistance of the patient. So if patient has poor resistance, the complications are more. Similarly, if the causative organism was virulent, more high virulent, the complications are more serious. And that sometimes disease may spread beyond the middle ear, so it can spread to the other parts also. It can lead to acute mastoiditis. Mastoid is the bone on the back. If you put a finger on the back of the ear, that's the mastoid process or mastoid. So if the infection spread to the mastoid process, it can lead to mastoiditis. There is also can be subperiosteal abscess, periosteum, facial paralysis, labyrinthitis, which is the inflammation of the inner ear, or labyrinth, petrositis, extradural abscess, meningitis, brain abscess. So all these are the complications that can involve different parts of the brain or the bony parts of the skull, because ear is all interlinked with these structures. So if the infection spread beyond the middle ear, all these structures or parts can be affected. So complications can be serious if not managed or not treated properly. Infection can spread beyond the ear, and it can involve the structures like mastoid, periosteum, meninges of the brain. All this can occur. So that was all about we talked about the complications, pre-suppuration, and then the resolution phase of the acute suppurative otitis media. Thank you for watching sqadia.com.